Good morning, guys. Well, it's been an eventful morning so far. Had a call from the alarm company, so I had to nip to clinic with my troops to back me up just in case there was an intruder. It was a false alarm. I think it was a fly. So they're quite sensitive, these alarms. So took the troops for a walk. Dexter got into a scrap with a husky cross Malamute, and I got bitten in the separation. So I've been to A&E, had some steri strips and antibiotics. Then took the troops for a walk, so they're exhausted now. So hopefully have a restful day. And yeah, here we are. What have I been mulling over? I'm always mulling over something. Had a email from one of my guys the other day, young guy, early 20s. He came to me from another TRT clinic, a very well respected person in the TRT field. He was essentially dissatisfied with his level of care and service, and wanted to transfer his care over to somebody who had his best interests at heart. So we've dialed him in, well, we've done our best to dial him in. However, he still suffered with low testosterone-esque symptoms, and yeah, we made the joint decision to actually take him off TRT. Shock horror. TRT doctor takes patient off TRT. Because TRT is for everybody. Everybody should be on TRT. It makes you superhuman. And I'm thrilled to report that his levels have recovered. And he is feeling significantly better. He has a libido. He's had morning erections. His energy's better. And his numbers are actually pretty respectable. I think total T was 21, 22. And yeah, he feels loads better. TRT is not for everyone. It should only be prescribed after a thorough diagnostic workup. Now, what does that mean? Okay, because TRT is big business. And that's a shocking phrase to use, because it shouldn't be business. It should be a medical condition treated by proper clinicians, doctors who have your best interests at heart, not people that have a cursory 5-minute conversation over the phone with you and then hand you back to the facilitator. So, drives me mad. We should be looking at not only these accredited questionnaires that unfortunately lead you down the path of, I may have low testosterone and I may warrant testosterone replacement therapy. They are slightly misleading because everybody feels a bit blue sometimes. Everybody has bad days and blah, blah, blah. So they are useful screening questionnaires, but you should never use them as a rationale for starting a lifelong therapy that if you come off, you may not recover. It's absurd. So we have diagnostic blood tests. Now, these diagnostic blood tests should obviously be done fasted in the morning to see whether you have a deficiency. So, if you have low levels and you've done the questionnaire, surely now I qualify for TRT? No, not yet. What you should do is you should look at reversible causes. Okay, so from a blood work perspective, you should do the TRT Check Plus from Medichex or equivalent with your GP or another blood online company. Make sure it's a venous sample, not a capillary sample. I don't think they're worth the paper they're written on, quite frankly. We've had some wildly differing results when we've done finger prick tests and venous tests. So we only advocate venous samples. So I've done my questionnaire, I qualify. I've done my bloods, I qualify. I've looked at the reversible causes and I qualify. So now I need TRT. I definitely need TRT. Yes and no. You cannot overemphasize the importance of working with somebody that has your best interests at heart. So, as you guys know, I insist as in you will not be prescribed testosterone replacement therapy unless you have come to see me. Oh, but I live a long way away. Well, we had a guy actually fly from China yesterday. That's no joke. A guy flew from China yesterday to come and see me at the Men's Health Clinic, and he's flying back today. I will not compromise my integrity, my clinical care, to make a buck. So, the purpose of the face-to-face consultation we've discussed before, but you cannot make a clinical decision, in my opinion, via a Skype call, via an accredited questionnaire and diagnostic blood work, and believe that you are acting in the best interests of the patient. I need that face-to-face. I need to be able to look somebody in the eye, and 20 years of experience has led me to the conclusion that whilst there are guidelines, whilst there are diagnostic blood work that you can do, and it helps you compile a picture, that picture is not complete unless you have a face-to-face consultation with your potentially prescribing clinician. I have turned away a lot of guys who have ticked all the boxes and walked in thinking, is TRT right for me, doctor? And we've actually made the joint decision that it's not. I turn away business. That's absurd. Well, it's because the Men's Health Clinic is not a business first and foremost. It is a medical clinic that will act in your best interests. Had a guy recently, again, similar situation, ticked all the boxes. He was on levothyroxine, but his TSH was still elevated. So I sent him away to his doctor to optimize his thyroid function before considering testosterone replacement therapy. It's far simpler to do that than commit yourself to a lifelong therapy. And whilst testosterone replacement therapy can be super effective, it's only super effective if you've eliminated all the other potentially causative agents and you have a realistic expectation and you appreciate that it's only part of the puzzle. It's a very important part, but it's only a part of the puzzle. So again, as we've discussed ad nauseum, lifestyle, nutrition, exercise. So he, to his credit, due diligence, went back to his doctor, optimized his thyroid function, and he's still suffering. So he came to see me and we have agreed to start testosterone replacement therapy. And he actually thanked me for sending him to his GP and not selling him on the concept of testosterone cures all. So, something that cannot be said of others. Everybody should be on TRT. Give me strength. I mean, the body is incredible. There's thousands of processes that, if all working correctly, make you how you should be, optimized. But we should all be on TRT. No, we shouldn't. So this guy, early 20s, he was optimized. According to the numbers, everything was in check. Lifestyle, nutrition, exercise. But he wasn't feeling the qualitative benefits that are sold to you. So the picture is complex. And now that he's off TRT, after we did a restart protocol, he is super happy and super grateful. He's actually super angry at the clinician that initially prescribed him testosterone replacement therapy. And I can see where he's coming from. We've just been the subject of a GMC concern. Now, that concern arose from a member of the public that took 17 months to compile all of their evidence to try and taint our sterling reputation. So that involves screenshots of the TRT in the Facebook group, which were taken out of context, but 17 months. So that was clearly not a immediate concern of patient data. It was a carefully constructed, meticulous, it was Machiavellian it was a blatant malicious attempt to paint a very bad picture of the Men's Health Clinic. It went to a GMC expert who does not believe in the diagnosis of testosterone deficiency syndrome. He's an endocrinologist who does obviously believe in hypogonadism, but does not believe in testosterone deficiency syndrome and believes everybody should recover. He unfortunately mistook us for an online provider, which, if you know me, is quite possibly the biggest insult you can give me, because we do show due diligence. We insist on face-to-face consultations. We insist on a full diagnostic workup. And even if you qualify for TRT, I will only prescribe you TRT if I believe it is in your best interests. So to be mistaken for an online provider is, quite frankly, very insulting. And the report wasn't particularly favourable of these people, and I wholeheartedly agree with his assumptions and aspersions towards their nature and the rationale for these companies existing, business, and the fact that these companies are not acting in the best interests of their clients, not patients, clients. TRT is not business. It is a medical therapy that should only be prescribed by a clinician who has your best interests at heart, not has a cursory 5-minute consultation with you and then hands you back to the facilitator. Give me strength. So he sees the patients who are prescribed testosterone replacement therapy inappropriately, and he has obviously got an opinion that we are all the same, and we are not all the same. The Men's Health Clinic is a CQC registered medical clinic that has now been also inspected by the GMC, and guess what? We went to a interim orders tribunal in Manchester, no order, and we were informed yesterday that the GMC have closed the case with no further action, which is wonderful news. It was horrendous going through the whole process because if you know anything about the Men's Health Clinic, we pride ourselves on our professionalism and our clinical competence. We are constantly looking to improve our service and make it safer, and it isn't a shop, it is a medical clinic. So it's interesting, isn't it? You know, you have so many non-qualified people releasing books about how to be optimized, and especially there's one that is directed at sort of the younger crowd. A non-clinician, oh dear, you know, give me strength. You've got clinicians who unfortunately are doing a disservice to their patients because they are not adequately addressing all of the aspects of health in order to best advise their patients. Endocrinologists, you know, we have had numerous, tens of people who have come from NHS endocrinologists who have been on therapy, who have had therapy stopped because they've now got normal levels. There is an absolute absurdity to that. You only have to have a very basic understanding of the HPG axis to appreciate that testosterone replacement therapy is a therapy for life. You can come off of it and you can recover, as my young guy has. And interestingly, we've had an email yesterday from another guy who again came from the same clinician who we've really tried to dial in, and we, in all intents and purposes, have dialed in. And again, he hasn't seen the qualitative benefits that most of my other patients do, and it's quite disheartening. And he believes that he was started on TRT prematurely because he filled out the questionnaire, he had the diagnostic blood work, and then had a cursory consultation that did not explore the other lifestyle, nutritional aspects, exercise aspects. So, you know, choose with caution, guys. TRT is not always the best option for you. You need to explore everything, and only once you've explored that and tried your very best to address those potentially reversible or ongoing things that you should be addressing constantly, because as we've already said before, from a health perspective, health isn't something you achieve and then you can rest on your laurels and eat Mackie D's. You need to work at this constantly in order to actually feel the benefits of TRT. You need to constantly look at your nutrition, look at your exercise, look at your lifestyle, because irrespective of the most perfect numbers, unless all of those aspects are in check, you won't feel optimized. So the lesson is, TRT should not be a business. It should not be entered into lightly. You should work with a prescribing clinician that has your best interests at heart. And in my mind, that is 100% not somebody that has a cursory 5-minute conversation with you over the phone and says, yes, I think I'll prescribe you Sustanon 125 every 5 days. You've filled out the questionnaire, you've got borderline low levels, so yes, let's give it a go. That's not how I will ever practice medicine. I will always act in your best interests. So yeah, buyer beware.